Well, good afternoon, everyone. Thank you for joining us again. Kind of want to describe the physical setting here. We're observing the President's request that we not have more than 10 people in a room, and so we are in this room in the Capitol building, and the press corps are in two separate rooms, and I'm pointing because I'm looking directly at pictures of them in each of the two rooms. So, for 52 years, my wife Fran has been the rock of our family. Fran I met in first grade. That has the advantage or disadvantage that she knows a lot about me and knows all my grades throughout the years. We have 8 children, 24 grandchildren, and so I've asked Fran, as we really enter a time that none of us have ever experienced in Ohio, as we enter that period of time and are in that period of time, I've asked Fran to kind of share with Ohio families what she is doing with our family to kind of get us through this and to keep us together as a family. So, Fran?
Thank you, Mike. You know, this really is, as Mike said yesterday, it's no ordinary time, and it's certainly no ordinary time for families. But I see Ohioans coming together all across the state to help each other. You know, when it was first announced that the schools were closing, what I worried about is, how are those kids going to eat? Are they going to get food since they won't be going to school? But immediately, leaders and volunteers jumped into action in communities all over the state. And within 5 days, 350 schools opened doors to provide meals. Because of social distancing, we have to figure out kind of new ways to feed the kids. A couple of examples in Washington Courthouse. For their summer feeding program, they have what they call the Big Blue Bus, and it's a bus that they've outfitted to take meals to different places in town to feed kids. Well, so they've brought that Big Blue Bus out now, and they're using that to get food to the kids for their school meals. In Dayton, they're doing kind of a consolidated meal pickup. So on Wednesdays, kids can go to their school and pick up a bag that has enough food for 5 days. East Cleveland, the volunteers and the community leaders came together beside the school staff, and they're preparing bags of food, and so they're just making sure that each kid gets to eat. So I think that's such an important thing that we had to do to make sure that these kids were still getting their food. But there are a lot of things that families can do and that we're trying to do, in our family. One of the things that we love and that I encourage all parents to do is to read to their kids. Last week I started reading The Little House on the Prairie series to one of my granddaughters, and it brought back a lot of memories for me, and she was pretty fascinated by it too. This past year, one of the main things that I've been concentrating on is setting up the Imagination Library in Ohio. And for those of you who don't know, this is a free book in the mail to every child every single month from the time they're born until they turn 5 years old. So I encourage you, if you haven't signed up your child yet, we hope you will do that. It's ohioimaginationlibrary.org to sign them up. We have about 75 counties it's available in, and just a few more counties to go. But if you go to that website, you can sign up, and just as soon as it's available in your county, you will start getting the books. So we hope you'll take advantage of that. One of my favorite things over the years to do with my children and my grandchildren is to cook with them. And this is, I think, a great opportunity now, since we all have to eat, to cook with your kids. My granddaughter Jean helped me make some Play-Doh for her little brothers, and it's sort of a fun thing that you can do at home with just basic pantry items, salt and flour and water. And so I actually posted that recipe on my Facebook page. So if you want to check that out, you can do that. It's a very simple recipe, and I think we've posted it at facebook.com/Fran DeWine, or you can also find it at Fran DeWine on Twitter. I showed my granddaughters Izzy and Jean also how to make noodles. And so tomorrow I'm going to make some more chicken and noodles. It's something that my grandmother taught me to make years and years ago. It was sort of her signature recipe, and it's very easy. So, tomorrow I'll put the recipe up, and you can work with your kids and make some noodles. It's just a fun thing to do. You can make them into chicken and noodles, or the last time we tried, we made some fettuccine out of them. But just little things like that, I think, can help bring families together. So just go in the kitchen and cook with your grandkids or your kids. When I make my chicken and noodles tomorrow, I'm also going to take some to my mother, who is 93 and living in her own home. But I think it's so important. She really does feel isolated now because the kids can't come to see her. And so, I regularly take food to her, and my sister takes very good care of her. But, what I'm trying to do right now is to help her learn how to FaceTime with the kids. Some of my grandkids who love to FaceTime with me, I'm teaching them to FaceTime with Grandma Strewing. And it really brings great joy to her and keeps her from feeling so isolated. So I think, even with the older members of our family, if we can use some technology to bring together, even though we're doing the social distancing, it's just so important that we make them feel part of our family still. There's lots of educational things we can do with our kids. Scholastic has opened up a great program, so you can check that out on different things that you can do with your kids. It's a good time to, in a couple of weeks, you'll be able to prepare your garden, clean your closet, walk your dog. I heard that some of my grandkids were playing baseball in the backyard a couple of days ago. My son-in-law is teaching himself how to play the guitar. I saw a list of books that my son decided that, you really need to read, that he put up on Facebook. So there's all these things that you have. Maybe you were waiting for a snow day to do some project like create an album or organize your pictures. We can use this time, and we can do it, with everyone who's in the house with us. Use this time to help everybody to become closer together and share fun things and make it fun for the whole family. Thank you.
Well, good afternoon again, everyone. Thanks, Fran, very much. I want to talk at first today about testing. I want to clear up any confusion that Ohioans may have about whether they should get tested or not. I was on a call this morning, and the question was about testing. We get those questions a lot. Let me just repeat what Dr. Acton has said, and this is true all the way across the country. This is not unique to the state of Ohio, but testing is limited. Our testing capacity is limited. It will, in all likelihood, remain limited. But we should also understand that if you're worried about a family member or you're worried about yourself, that you may have the virus, and you feel like you need to get tested. I understand that, and I think we all understand that concern. But I really would ask my fellow citizens in Ohio not to fixate on testing. This is understandable. But as we have said all along, the vast majority of Ohioans who have symptoms do not need to get tested for the coronavirus. The vast majority of Ohioans who have symptoms do not need to get tested for this. If you're feeling symptoms of what you think might be this virus, you should act like you have it, which simply means that you should stay home, that any member of your family, anybody who lives with you in that home, should also stay home. The best thing you can do, the most responsible thing you can do, the most heroic, the most patriotic thing that you can do is to stay isolated at home. Your family members, everyone who lives in your home, as I said, needs to stay there as well. The vast, vast majority of people who get this will be able to stay home. They will not need to be hospitalized. Of course, if your symptoms worsen, call your health care provider, whoever that might be. And if you find you're having any difficulty breathing, then obviously you need to go right away to the emergency room. While most people will, in fact, be able to remain at home, the most important thing we can do right now, and I really can't stress this enough, is to reserve the limited tests that we do have for those Ohioans, our fellow citizens, who are the sickest and who are the most at risk. We must reserve those for those individuals. And let me talk for a moment about why that's so very, very important. Keeping our health workers, our doctors, our nurses, our first responders, others involved in the healthcare system, keeping them healthy is absolutely essential so that they can take care of the rest of us. We have to have them healthy. We have to have them so they can be on the job. The doctors tell us that they want to test the sickest people, those who are exhibiting the most severe symptoms, so that our healthcare workers can best utilize their very limited personal protection equipment. They need to know who has the virus so that they can use the right protective equipment to keep the virus from spreading to other vulnerable patients in that hospital. And it's very, very simple. They need to know the patient in room 202 has the virus. And so reserving it for those people who are sick, who go into the hospital, knowing who is coming into that hospital who has the virus is vitally important. Efficiently using our limited testing will enable our scientists and disease detectives to better understand the spread of the virus. This has to be done in a very targeted, methodical way, which means deciding who is tested needs to be determined by the doctors and the scientists who are really at the front lines. It's just so very, very important. And here is the truth. With or without a test, the virus is here. It lives among us. And we must be at war with it. And we're at war with a very, very dangerous and lethal enemy. This virus's mission is to reproduce. And for it to go from person to person, it needs our help. It cannot do its damage without us. We become the enablers. We become the ones who make it able to jump from person to person to person. We have it within our own control how fast this spreads and how widespread it spreads. We have within our hands not only our own safety, but the safety of our fellow citizens. This enemy is dangerous, it is relentless, and it is using us. It is using us as its host, and it is using us to survive, to multiply, to go from person to person. But we do have it within our ability to fight back. When you stop moving, when you stop moving, when I stop moving, it stops moving. It can't reach someone else. So each one of us must do all we can to limit our exposure, and we must stop enabling this enemy. We must stop it from surviving, multiplying, and thriving. Every one of us is in this fight. We don't need to go into the battlefield ourselves. We simply need to stay at home. We simply need to have space, no matter where we are, between us and other individuals. We certainly, as Fran indicated, need to stay socially connected, but physically separated. Every single one of us, every single one of my fellow Ohioans matters. And we will get through this. And we all want to get through this together. As I said yesterday, we all want to be here for next St. Patrick's Day. We all want to be able to celebrate. We can get through this together. We can stay healthy, and we can get through it faster. But it's really on us. It's on us, each and every one of us. And it will take each one of us, certainly, to win this battle. Our goal every single day must be to stop the spread, stop this spread, slow it down, flatten that curve that we've talked so much about. I ask each and every one of you to help slow this thing down. I'm announcing some additional steps that will help. And let me go through these. The Bureau of Motor Vehicles has about 1 million people that go through their doors throughout the state of Ohio to all the BMVs each and every month. That's an opportunity for us to slow this down. Therefore, we'll be closing. At the close of business today, we will be closing 181 BMV deputy registrar locations. 5 of these will remain open because they are essential. And you're going to hear me talk as we move forward in the next several days about things that are essential. We should only be doing those things that are essential for the health and welfare of the people of the state. Our transportation system is important. We have to keep moving the food. We have to keep moving the medical supplies. Therefore, 5 of these facilities will remain open to issue commercial driver's licenses, CDLs. They will be open for the renewal of those CDLs as well as the issuing of the licenses for the CDLs. All other services will be online or by mail, or they'll simply be paused. Also 52 driver examination stations will close. We will be asking the General Assembly to pass legislation that will grant a grace period for people who could not renew their license. In the meantime, we are asking all law enforcement in the state of Ohio, and I am instructing the Ohio State Highway Patrol and asking all other law enforcement to not issue tickets for someone who has, in fact, an expired license, which would be due to the fact that from the close of business today, they cannot get a renewal. We're asking, and we will be ordering at the close of business today, that all barbershops, hairdressers, nail salons, spas be closed. Tattoo parlors as well. Let me talk for a moment about our libraries. Our libraries can be essential and are essential parts of our community. We are not ordering today the closure of our libraries. We're going to leave this up to each individual county, each individual library. We would ask them, however, to deliver the services, as many of the services they can, in a way that does not put people together. The social distancing. If they're in a situation where they have a room and people are crowded in that room, that has to stop. We're going to let them figure out how to distance people. Some libraries, I believe, will close from talking to them, and we'll try to deliver some of the services on a curbside basis. Again, our goal is social distancing, putting distance between people. Let me now speak to every business in the state of Ohio. Retail, manufacturing, service, any business in Ohio, any nonprofit, any other place where employees show up. We are asking them, beginning immediately, to take the temperature of every single employee every single day before they come to work. Second, we're asking them to be very, very aggressive in regard to cleaning surfaces, in regard to having the availability of soap and water, the availability of hand sanitizers. These are things that businesses can do, and they can do immediately, and we know that many of them are already doing this. We also ask them to be vigilant. If an employee is sick, certainly if an employee has temperature, send that employee home. The temperature check is not perfect, but it certainly is one way to screen individuals out, the employees who come in, and not have them there during the day as customers come in and also infecting the other employees. Let me talk now about our National Guard. It seems that there cannot go a day by when I don't get a call about some rumor about the National Guard. Let me just be very, very clear. When the National Guard is going to do something, you will know about it. The National Guard, sometimes people think of calling out the National Guard means that they come and they have guns and they're going to do some military operation. Please understand that the way the National Guard is usually used in the state of Ohio and other states is to help us, assist us, not necessarily in that manner. National Guard is called out sometimes in floods. In some cases, they're called out to be of help in regard to tornadoes. They have lift capacity. They have transport capacity. They can do many, many, many wonderful things. Just as a couple of examples, the National Guard will be helping hospitals erect tents. One of the things that you're going to see in front of our major hospitals are tents. These tents will be there so that they can isolate patients, check patients. They'll need more space. Hospital will determine how that tent is used, but we've received requests from hospitals. I talked to General Harris this morning. Dr. Acton and I did, and they have tents, and they certainly have the ability to erect those tents. And so you will be seeing that. We've received a request from food banks just to give assistance by the National Guard. They will be doing that. So that's the type thing that you're going to see the Guard do. If there's a change in that, this is really, quote, civilian work. This is work where we can take the expertise and the equipment that the National Guard has to help us as we go through this. Lieutenant Governor Houston and I both received a text picture today, and I won't talk about where it was from, but what it reminded both of us is that even if you're doing volunteer work, even if you're doing the Lord's work, you're doing important things, please observe a no congregating rule. This was a picture in a room, and the people were doing great work. They were volunteering, but they were together as a bunch of people in a room. So even if you're doing important work, still observe that distance. That is very, very important. Again, to our businesses. We have employees who are going in every single day. Please, please check them. Please make sure that you're complying with what I'm saying today. It's so very, very important for their safety. And again, all of this comes back to separation. As I talk to people, I get a lot of emails and I get a lot of text. And I think Ohioans are really beginning to understand where we are, and what they have to do. But it's also clear to me that some of our fellow citizens do not really understand it. They don't really get it. This is a crisis that you have never seen in your life, and I hope you will never see again in your life. But we have to get through this. And I'm calling on every Ohioan, when you're going into a situation where you have the potential to spread or to obtain this virus, that is very, very dangerous. This virus is, as we have said, we believe is twice as contagious as the flu. It is 20 times as deadly. It is coming after us. And we have to take whatever action is necessary to preserve lives of the people of the state of Ohio. I'm going to ask Dr. Acton now to come up and to talk a little bit about the testing and other things and really kind of give you all a report of where we are at this point in Ohio. Doctor?
Thank you, Governor. Good afternoon, everyone. And I also want to thank First Lady Fran DeWine. She knows that books are something that are very near and dear to me. Some of you know my story and that I had a pretty rough childhood, and I've been thinking a lot about the kids who are out of school, because for me, summers were a really long time, and this is like a big summer vacation. And it was the books that made all the difference and gave me a sense of life being different than the way I knew it. And so I think those books are important, whether in our little free pantries in our neighborhoods or how we do that. You just wipe them off. I think they're going to help a lot of us through this time. So thank you for the work you do. And I want to start off with a little information about our cases. And as I've said, I'm going to tell you some very important things about the history of how we came here today. I know we've all been waking up to the situation we face. It dawns on us, even those of us who have been doing it nonstop since this began. It comes in waves. And so I'm going to take us back through, because I think there are some valuable lessons and some fallacies out there that I think we need to correct. But first of all, we do have 88 confirmed cases in Ohio. We have not had testing until recently, and as you're hearing in all the national news channels today, we have a shortage of tests. We are having to prioritize who we test. I will tell you why we don't need those tests to know the right things to do right now. But the fact is, our case numbers are only an example of mostly history. They're just the tip of the iceberg of what's actually happening in Ohio, and I will tell you more about that in a minute. Our age range now, and please understand, it is from 2 years of age, hospitalized 2-year-old that we had, to 91 years of age in Ohio, with a median age of 48 and a half years. The sex is split. I don't think we're going to have a big difference in this overall, but 33 females and 55 males. We have 26 hospitalizations, some of those requiring ICU and more support, and we have 0 deaths that we are aware of at this time due to coronavirus. We have at least 19 counties accounted for now, and some of those counties represent outlying counties. So those are our numbers as we know them. Let me tell you a little bit about Ohio, and I say this because it's so important. We states need to all see each other in the same boat. But Ohio, which was very, very late in our ability to test, is actually the 7th most populous state in this country. We are 11.7 million, give or take a little bit, and those are our numbers. We have major, major companies, global companies here. Myself, as a professor of global health, worked with the folks at Ohio State, the Ohio State University, who actually came up with the concept of zoonotic diseases, the disease like we're seeing here that leapt from animals to humans, that studied this concept of us, and they coined this term, One Health. In this world, we are one world, and we are one health. And zoonotic diseases are actually the greatest indicator of that fact, and we're seeing that unfold right now. As far back as the beginning of this disease, which was the outbreak in Wuhan when it was most known to the general public, was December 31st. And I heard about it right around that time in the first week of January on a call with some folks, global CDC health folks were talking about a zoonotic disease and what was going on in the market in Wuhan. I don't know if everyone knows, but the state of Ohio is actually a sister state with the province of Hubei. So we have all these businesses who are doing business all over in China, and we also have our universities. And at the time, it was the beginning of spring term for the Ohio State University, and we have some of the largest number of public and private universities, many people from the coast send their kids here for our small liberal arts colleges. And so we were having many students and faculty who had traveled. We had Chinese American citizens and others going back home for Lunar New Year, and we had, many faculty coming back, students who had traveled abroad. And it was January 15th, actually, that we had the return to the U.S. and the symptom onset of U.S. case number 1. Actually, on the 13th, we had U.S. case number 2 had returned. And so we actually began rolling out our pandemic planning at the Ohio Department of Health around that time. We began to use our pandemic plan. And that first case in Japan was January 16th. On January 17th, the CDC published a health advisory, where it gave the very first people under investigation definition that our epidemiologists began to use. And it was a very strict definition by fact. It was the symptoms of people who were in Wuhan city, travelers. This is not uncommon. I want people to understand this is not quarterbacking, after the game. This is just the facts. We were understanding this virus as it unfolded. But you have to understand our very first sense of a case, while we already had travelers, was people related to this market and to Wuhan. January 20th, the Washington State confirmed case number 1. U.S. case number 2 was identified by the PUI. The first case in South Korea was known. And CDC Chicago confirmed the U.S. case number 2. We saw our first cases in France. This is January, late January. Our first case in Canada, our first case in Australia. January 27th was the first case in Germany. And for those of us in Ohio, we were first made aware of it as a population because we had our first people under investigation by that CDC case definition at Miami University. 2 students, if you remember. And we sent our specimens to the CDC, and those test results came back not until February 2nd, because it took us that amount of time to send the case and turn around that. So we were relying on cases going through the CDC. All the while, we had people returning from business travel and conferences all over the world. On February 1st, we extended that PUI definition based on the CDC to Hubei province, or people with severe symptoms or hospitalization after travel to China. We, again, on February 2nd, got our first negative results, and we began to test and actually tested 8 different people under investigation through March that ended up being negative. Travel restrictions were implemented February 3rd, and on February 7th, we got our first test kit from the CDC. Unfortunately, we were one of the handful of states that 2 of the 3 reagents did not work, so we continued to rely on CDC testing. All this time, we began to receive word, of course, of the Diamond Princess. We had other travelers returning. We began to monitor. And in Ohio, whenever we had mixed guidance, we took the most conservative of the guidance. So as we had travelers return from the 11 airports, our local health departments worked with those folks. Over 250 people self-quarantined as returning travelers from China for 14 days. They voluntarily did that, and we monitored them. We did our first tabletop exercise as a cabinet under our governor during mid-February. But of course, on February 16th, we saw the first market crash. And on February 27th, the governor and I did a press conference really beginning to help the public understand what this virus is, and that was at Metro Health in Cleveland. And that was very important because we made a promise to you that we would tell you everything we know as we know it, and that's when our dialogues with you began. On February 28th, the CDC changed the definition of PUI again to people with severe symptoms with no alternating explanation. We began to realize that some of our cases that looked like the flu could possibly have been people sick with this. And of course, then in late February, we saw the cases on the coast of people, our folks from Ohio, returning from conferences like APAC and Biogen, the CPAC conference. And that's when we began to realize, even though we did not have widespread testing yet, that we were already seeing people in Ohio who are at risk. By March 3rd and March 4th, we made the very difficult decisions, watching what was happening around the world, watching what we were seeing in Italy, watching what we were seeing from our colleagues and their advice to act early and not wait, because we knew 2 weeks would make a difference. From our colleagues in Washington, we made some very difficult decisions around the Arnold. And that began our look at mass gatherings and the beginning of moving into mitigation. We also, on March 5th, received our test kit. It took us the 2 days it takes to validate. We initially set up our kit on the weekend of March 6th, and on March 7th, we validated it 8th, and on the 9th, we came to you with our first positive 3 cases. So our ability to rapidly test, we began to see cases, and the additional cases have come since then. All of this is very important for me to tell you because I think a lot of the decisions we're making now about testing and where supplies go, our reality is that we have limited resources, we have limited PPE, and we will never know, just through our cases that we have so far, we know we have widespread community transmission. And we have to assume, remember, our initial date of onset of symptoms of one of our known cases was February 7th. So we all have to assume that it is amongst us. It probably has been here. And if we decide to allocate resources just based on number of cases, we'll be missing the mark. Because in Ohio, we will not know those numbers. We may never know fully who all was exposed during this time. And right now, we are going to limit our resources and our testing to those who are hospitalized and our healthcare workers. You already know through the news that we have a shortage of swabs. And even though we ramped up our testing capability, we have extraordinary. We have the Cleveland Clinic, which is an international, some of the best hospitals in the world in Ohio. And they have done that. They ramped up their ability to test, but we have a shortage of these things. And so with them and with our other hospitals, we're talking about limiting our testing to those that are hospitalized and most sick and most at risk. For those of you at home, I know that us talking about taking this issue of testing in some ways off the table for most of us, the 80% of us who will stay home, is a very scary thought. But I can tell you this, even if you get tested, even if I were tested today and was negative, it does not mean I do not have the disease right now. It might just be too early in the disease process. I don't yet have the viral loads. And even if I do test positive, for me as an otherwise healthy person, when I start having symptoms and I talk to my doctor and they do a good case history with me, they will tell me to stay at home. And whether I'm positive or negative, it really doesn't matter because, as a doctor, most people who get the flu often are not tested. As a doctor, I might say, you know what, you sound like you have the flu. I want you to be at home. I want you to take the usual precautions, keep yourself comfortable with these measures, and then call me if you have worsening symptoms.